Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is April 28, 2025. This video is on a New England Journal of Medicine paper published on April 23rd, titled Lorundrostat, Efficacy and Safety in Patients with Uncontrolled Hypertension. This was published by the Advanced Hypertension Investigators. Uncontrolled hypertension remains a major cardiovascular risk despite multi-drug therapy. Aldosterone dysregulation drives persistent blood pressure elevation. Lorundrostat, a selective aldosterone synthase inhibitor, may directly lower aldosterone production with fewer side effects. The aim of the study was to evaluate Lorundrostat's efficacy and safety in treatment-resistant hypertension. It was a phase 2b multicenter double-blind randomized placebo-controlled trial. The study population included adults with uncontrolled hypertension on 2 to 5 medications. 285 individuals were randomized. The intervention included Lorundrostat 50 mg per day stable dose versus 50 milligrams dose adjusted up to 100 milligrams a day versus placebo. The primary endpoint was change in 24-hour ambulatory systolic blood pressure at 12 weeks. What did they find? Lorundrostat 50 milligrams reduced systolic blood pressure by 7.9 millimeters of mercury versus placebo, p-value equals 0.001. Dose-adjusted Lorundrostat reduced by 6.5 millimeters mercury, p-value 0.006. Secondary outcome at 4 weeks, minus 5.3 millimeters of mercury versus placebo, p-value less than 0.001. Safety, hyperkalemia, that is potassium levels greater than 6 millimoles per liter, occurred in 5 to 7% of the Lorundrostat groups versus 0% in the placebo group. Key takeaways: Lorundrostat significantly lowers 24-hour ambulatory blood pressure in patients with uncontrolled hypertension. Benefits were seen across racial groups, including a high proportion of Black participants. Hyperkalemia and reduced eGFR were notable side effects, but manageable. Lorundrostat represents a promising addition to treatment-resistant hypertension therapy. The limitations of the study were short 12-week duration, limits the robustness of long-term blood pressure and renal outcomes, potential overestimation of treatment effects due to placebo blood pressure decline, and there was no direct comparison to another mineralocorticoid receptor antagonist. Active control was lacking. Podcast brought to you by Master MedFacts at mastermedfacts.com.